I am Dr. Langdon Fielding, and I'm one of the veterinarians here at Loomis, Basin, Equine that works in our intensive care unit and helps take in and manage a lot of the emergencies. Today we're going to be talking about horses with repeat episodes of colic. All right, as many of you guys have heard us talk before, colic is a really common problem that we see in horses, and it's one that we talk about a lot. Today's talk is actually going to be a little bit different. It's going to be about horses that colic but do it over and over again. So it's not the horse that all of a sudden you find in the pasture and it's really bad and it's a crisis, it's an emergency and you're rushing him to the hospital. It's the horse that maybe colics a little bit, you're worried, and then maybe an hour later he's fine again. And then about a month later, does the same thing, has another episode of colic, kind of maybe you don't even have to treat it that time. Then maybe a few weeks later he does it again. And there's actually quite a large group of horses that do this, and what we call them is chronic colickers or repeat colickers. And they're basically horses that it's never really bad enough to need things like surgery, and maybe not even bad enough to come into the ICU. They're basically horses that just get kind of like a mild bellyache over and over again. But sometimes it gets so bad that they start to lose weight. It's really hard to, take them to competitions or go on trail rides with them because you never know when this is going to happen. So before we get started with the things that cause this and how we figure out what the source of the problem is, I just want to do a little quick reminder of what signs of colic are. And remember, it's essentially anything kind of in their abdomen that's causing them to be uncomfortable or painful. So the sort of classic signs are those that, they're pawing the ground, maybe they're looking around at their side, they could even be rolling. These repeat colickers are often actually the milder signs of colic, so they may be the horse just doesn't want to eat. He just is maybe like pacing around his stall. Some of them are so subtle that only you as the owner will actually know that they're signs of colic. So, you go out and you're like, wow, he always comes to the front of the stall, when I come out here to feed him, and instead he's just hanging in the back. Or he's, like I said, he's normally playing with his food and interested in what's happening, and he's just kind of standing over in the corner. So these can be really subtle signs, but basically what we're talking about is the horse that he does it, he's a little bit better, and then maybe another, a couple weeks later, same thing, you just notice him. They can be more painful. Some of them can actually be pretty significant where they're down and rolling and doing things like that, but at other times, really subtle signs. All right, so we're going to talk a little bit about some of the potential causes. So as far as things that cause these repeat episodes of colic, unfortunately the list is probably 20, 30, maybe even 50 different things. But what we try to do is go over really the most common ones, so the ones that you're likely to see in your horse. So I'm going to kind of touch on what I call like the big four, which is essentially the ones that we see here at the hospital the most commonly when we do all the tests and make the diagnosis. But again, feel free, if you're having a horse that's having problems, feel free to talk with us about it. It is a really long list, and sometimes we have to do some additional tests to figure it out, but we're going to at least touch on the main ones today. So probably what used to be number one in this area were the enteroliths, the intestinal stones. And so many of you guys have seen these. These basically form inside the horse's colon, in the horse's intestine. And they are pretty tightly linked to horses that eat a lot of alfalfa. There are risk factors like breeds, so Arabians are at higher risk. There's been a couple studies now that show that some of the other breeds can also be at a little bit higher risk. But basically they almost always happen in horses that eat a lot of alfalfa and potentially have done that for quite a long time in their life. So if you're a 10-year-old horse who happens to be an Arabian, who eats all alfalfa and is colicking over and over again, we're going to think something like an enterolith is really likely. Now it's interesting, in the almost 20 years that I've been doing this used to be really probably the most common cause of repeat colic in horses, but now with more education and people learning that feeding all alfalfa to horses increases their risk for this, now it's actually, we don't see it as often as we used to. So still a big problem, still a really preventable problem, but it still makes our big four list, but it's starting to work its way down a little bit. We probably don't see it quite as much. The next one I want to mention, which actually we do see probably almost now more than anything else, is what we call sand colic. And this is a type of colic that we see most commonly in horses that eat on the ground, and particularly on like sort of sandy dirt, even sometimes like DG or gravel. They'll start to pick up like the little pieces. And so as the food either falls on the ground, or if you feed it on the ground, it gets mixed up in the sand or the gravel, and you end up with them, ingesting it as they take in their food, and then slowly over time they build up the sand in their intestines. The amount of sand they can build up is incredible. So sometimes it may be, up to, pounds, like tens of pounds of sand that sort of fill their intestines, and it makes them basically really uncomfortable. The reason that a lot of them don't get really bad colic with this is the sand keeps moving through. So it's essentially just like really, really irritating as it like pushes its way through the intestines. And that's what kind of basically makes them really uncomfortable. This is really common for these repeat episodes because, as you can imagine, the horse does this over and over again, right? Every single day they eat a little bit more sand, and every single day they have to pass some of this sand through their intestines. And so you'll see a horse that, colics once, 2 weeks later he colics again, another week later he colics again. And so for us in this particular area where we have a lot of sand and DG, this really has become one of the most common ones that we see for these repeat episodes of colic. Right, number 3 on our list is what we call like a displaced colon. And so it's basically where part of their intestine just ends up in the wrong spot. So the horse's anatomy is on the inside of its abdomen is incredibly complicated. It makes a big sort of all these big loops and turns and twists. And essentially if any of that doesn't sit in the right spot, they start to get uncomfortable. The gas starts to build up, the feed starts to build up, and you end up with these horses that just kind of have these belly aches. And they're interesting. Sometimes, it can be so bad that it twists, and then that's the kind of classic colic that we talk about where they come in, they're super painful. But a lot of times it's just a little bit out of place. And what happens then is the horse gets maybe a big gas bubble, it's uncomfortable, and then everything shifts just enough and the gas gets through and they're okay again. And then maybe 3 or 4 weeks later, the same thing happens again and we see them one more time. And so there's actually a lot of different versions of this, but we call them displaced colons. It just means that essentially their colon or their intestine is just in the wrong spot and it just kind of got stuck there. There's some interesting research that kind of debates whether these colons, eventually return to the right spot or not, but they are definitely a big problem for us with these repeat episodes of colic. And then number 4 on our list, which we again see really commonly in this area, are stomach ulcers. And so a lot of you guys are familiar with a lot of the educational talks that we've given on this topic before, but really almost every horse that we see is potentially a candidate for stomach ulcers. The higher risk ones are like race horses, eventing horses, endurance horses, any of the really high risk performance horses we see them more commonly with. But even in the pasture horses and brood mares we can see it. And these horses are another example. For a few days they'll be fine, then another day you'll notice that they just don't want to eat well. Maybe again they're like pawing a little bit and it seems like they're okay, and then a few days later they do it again. And so it ends up being just a sort of a repeat over and over episode of colic, and it's a big problem for us in our area. So now that we've talked about the kind of the 4 most common ones, and again to emphasize there's a much longer list than that, it's just those are the 4 that we see the most. Other things that we'll sometimes see are things like cancer can cause it, infections can cause it, really almost everything in horses unfortunately seems to be, repeat episodes of colic can be something that shows up, but those were the big ones that we covered. So as far as testing, there's a lot of different tests that can help us, but probably one of the first ones that we start with is an x-ray of their abdomen, and we are basically looking for both the stones, so the enteroliths, and the sand that they could be eating off the ground. And so as I was saying, this actually is probably one of the best tests that we have because you cover 2 of the most common causes with one test. So you bring the horse in, we take the x-rays, and pretty much right off the bat we can say, is it a stone in their abdomen? Is it sand in their abdomen? And it gives us the answer right away. Abdominal x-rays are incredibly valuable. They look for intestinal stones, they look for sand. We can actually find other things sometimes, like if they've eaten a piece of like a screw or a piece of metal, that will show up on the x-rays. So it's really probably our go-to test for these horses that colic over and over again. Second most common test that we do and is really helpful is just what we call a routine blood panel. And the reason this test is so valuable and also so efficient is that it covers so many different things at once. So really with this sort of one blood draw, we covered things like infection. We can get some hints if cancer could be a problem, things like kidney, liver, basically a whole range of different conditions that could cause repeat episodes of colic are all covered in this one fairly inexpensive test that we can get the results back in about 30 minutes. So it's another one of our kind of big go-to tests that if you come in here with a horse that's colicked over and over again, we like to get those x-rays and we like to get a blood panel because it really helps us almost immediately tell you, hey, what are the things it is likely to be. The third test that we'll often consider, and this is actually one of the most inexpensive tests, is just a simple fecal test for parasites. Many of you who are in our EQ Protect program are already doing this once a year, so if you've already have it in the record, then we'll just go and check the results and make sure that there's nothing there that we need to know. If you're not in the EQ Protect program and haven't done one of these tests, it's definitely something that we'll want you to do. Again, it's really inexpensive. And we're kind of looking for a couple of things. I mean, one, just, is obviously, are there a number of parasites? We also, at the same time we do that test, we'll also float that manure for sand. And so it's another test for sand. It's not as good as x-rays, but it's another way to just identify if the horse is eating a lot of sand, is a lot of sand coming through. And so we kind of get both things out of it. The one limitation with a fecal test for parasites is that there's certain parasites that kind of burrow into the wall of the intestine. We call them encysted cyathostomes. And they don't always show up on the fecal test. And so there's some limits to this test, but it's another easy one to look to see, if that's the source of the problem. And then the last test to discuss that we do would be the scoping for ulcers. And so you guys have probably heard there's some different tests out there for checking for ulcers and seeing if the horse has them. But really, truthfully, the most effective way to do it is just to run the camera down into their stomach and look and see if they've got the ulcers. We do have to hold them off feed for about 16 hours or so to have this test work really well. But it's really nice. Again, if it's completely clean, we can cross that off our list and move on to some of the other causes and start searching for the other reasons. However, if they do have significant ulcers, it's actually quite a treatable disease, which we'll talk about in a few minutes. And we can get you set up on the medication for it, and the problem will be solved. All right, lastly, we're going to start talking about the different treatments. And one of the reasons that we really wanted to give this talk, especially right now, is this is one of these conditions that some of the treatments involve medications and ones that need to be prescribed, but actually some of them are things that you can just use at home or even try at home. We'd like you to at least talk with us first, maybe before you try making some of these changes, because sometimes they may not be indicated for your specific problem, or there's a specific order that we'd like to do them in. So if you just go out and start trying stuff, it can be hard for us then after the fact to try to figure it out and help you. But a lot of these things are really, really simple things, and there's stuff, like I said, that you can do just at home, and you don't necessarily always need to have a veterinary visit to try some of these. All right, so the first, I'll call it a treatment, but a modification that we make is trying to change the horse's diet. And one of the most interesting ones is to try to switch a horse that's maybe stall confined and used to eating like only hay, and then start introducing more pasture into their daily life. And so that's basically turnout, where they can, essentially, eat and graze on green grass. This is really important for a couple of reasons. For horses with ulcers, it's beneficial because it means that they're out walking around, just eating a little bit all the time. They don't eat all their food at once and then they have nothing to do all day. So they're just constantly out moving. But even for some of the other conditions like the displaced intestines or things like that, it makes a huge difference because the horse is just constantly moving, constantly eating a little bit. Like, this is what they were supposed to do. They're not supposed to eat a huge amount of food all at once. They're supposed to do this thing where they just nibble, move, and do it like that. So we really, really like to use the pasture as essentially a treatment trial. All right, so pasture is one of the things that we will often try with these horses. Our second sort of treatment trial, if you like, is to switch them to more of a pelleted feed. And so one example that we use here a lot in the hospital is stable mix, but there's a lot of actually excellent pelleted feeds out there, so we don't endorse a specific one over another, but it's one that we use a lot and has been really successful for us. And there's a couple of reasons that we'll do this that kind of make sense. If you, again, go back to the horse that's got potentially this displaced colon, so a colon that's moved out of its normal spot, sometimes by switching to more of a pelleted diet, it just makes everything in the intestines smaller. So instead of the hay, which takes up a lot of space, you put them on something like a pelleted feed, which it just takes up less space. It's a little bit easier to digest. And it's really interesting. It can be almost miraculous in some horses. If you have a horse that's maybe been on hay his whole life, and is starting to have these chronic colic problems, some of them will gradually switch over to a pelleted feed, And it's really interesting, a lot of the colic signs will slowly start to go away. It may even just be that they get spread further out. So maybe a horse that colicked, once a week will now colic once a month, or maybe once every few months. And so it can go for something that really is making it hard to take care of your horse to actually a much more manageable situation. So it's really one of our, I would say, kind of favorite treatments and favorite trials to do. Another couple of important points about that. One is it's really important that you make the change gradually. You can't just take a horse that's always been on hay and go in there and dump a bunch of pellets and take them off hay completely. The other thing is that a lot of horses get sort of frustrated and anxious if they don't have a little bit of hay to chew on. So one of our favorite protocols is maybe we'll gradually change them over to a diet that's maybe 80% pellets, but still give them a little bit of hay so they feel like they've got something to kind of to mess with. Or we'll use like a slow feeder where they can just nibble on little bits of hay all day, but they're still getting the majority of their calories from the pelleted diet. Definitely before you make a change like this, please talk to us, because again, we can give you some indications on how fast to change, some indications on which one to use. So there's a lot that goes into making this decision, but again, it's a fairly inexpensive one and can actually be one of the most effective ones that we have. All right, the third treatment that we will often try in horses with these repeat colic episodes is another really basic one that's actually not expensive, and that is to do some very specific deworming. As I mentioned earlier, a basic fecal test is pretty good at finding, like regular strongyles, which is one of the problems that we see. And so we definitely, based on that test, may make some changes. But one of the interesting ones is, again, these parasites that can live sort of burrowed into the wall of the intestine. And those we may not pick up on a fecal test. And those also require very specific dewormers to effectively deworm against them. So one example that we've used to use in the past and still use today is the Panacure Power Pack. So that's the sort of 5 tubes of dewormer, and you use 1 tube a day for 5 days. It's essentially a double dose of Panacure. This is a common one that we've used. If you've had a horse with this problem, you may have had us help you with this. More recently, there's some research suggesting that Quest Plus, which contains moxidectin and praziquantel, is actually another great option for that and very effective and may have some advantages as well. So those are 2 common ones we'll do it. We're basically in general like to cover both these encysted small strongyles, and then we'll often also cover tapeworms with praziquantel. So we like to cover both of those to just eliminate any of those as possible causes of these repeat colic episodes. And then for the kind of last types of treatments I want to go through, there are ones that are really for more specific conditions. So as I mentioned before, trying to change to pasture, trying to change to pelleted feed, covering these dewormers, these are things that are maybe a little bit harder for us to diagnose, and so they're things that we try or we'll have you try at home to basically try to make these signs less common. There's a group now of treatments that we use when we've made like a specific diagnosis for repeat colics, and so I just want to touch on those as well. The first one, which many of you are familiar with, is using psyllium for sand colic. That's basically kind of our go-to as far as treatment for sand colic. The only thing we tell people is if we have taken an x-ray and really diagnosed your horse with it, it's also really important that you take them off of the sand. So number 1 is to get them eating in an area where they're not eating the sand. And then number 2 is we start with psyllium in their diet. There's actually some interesting evidence that psyllium, even in a horse that doesn't have sand colic, could have some potential benefits on the colon and might even help some episodes of chronic or repeat colic, but it's one of the things that we'll often try as part of our protocol. Number 2 would be trying omeprazole. So this is a drug that we use for ulcers. So again, ideally we've scoped your horse, we've identified whether ulcers are present, and then we use omeprazole to basically treat those ulcers. You guys are very familiar with it. Probably by far the most common one we use here is GastroGuard or UlcerGuard. Again, as a reminder, GastroGuard's to treat horses that have ulcers already. UlcerGuard we use to prevent new ulcers. But if your horse has been diagnosed with those ulcers, it's a very, very effective treatment. It seems to get rid of the clinical signs in a lot of these horses. So one of our, again, go-to medications when we have that particular diagnosis. Number 3 on the sort of extra treatments is prednisolone. It's a steroid, and so there are a group of horses that are a little less common, but they have almost like the equivalent of kind of inflammatory bowel disease, and so they're horses that just have this kind of ongoing inflammation in their intestine. There are certain things that sort of upset it or flare it up, and they can often very effectively be managed with some of the dietary changes, and then also something like prednisolone, which would be a steroid to quiet down that inflammation. And then lastly, we really have exhausted almost all of the other medical treatments that we have. we'll consider the option of surgery. And this is something for us with these repeat colics that really is our last choice. And the reason is that often the things that we find are not things that can be fixed surgically. And so we're really hesitant to take these horses to colic surgery because we know that many times it may not be the answer for them. But sometimes if the episodes of colic, they're getting so frequent that, really almost daily, or they're getting so bad that the horse is obviously just miserable and he's starting to lose weight and his quality of life is not very good, then we'll often, go the surgery route. And sometimes we are able to find something that's there that we can fix, and that's can be very helpful. So to summarize kind of today what we've talked about, basically repeat colic is actually quite a common problem in horses. And again, by repeat, we mean not the horse that has it once every few years, but the horse that, maybe once a month is having a colic episode and it's really, again, affecting his quality of life. Number two, the tests actually to diagnose this are fairly simple and straightforward. And so, give us a call, let's talk about it. But it's often just even a couple of tests. We can cover the most common causes and really often get you an answer. And then number three, which is probably the best news, there's a lot of very inexpensive treatments that can be really effective for resolving or at least improving this condition. And so again, talk with us. There are often things you can do at home or things that you can try that really don't take a lot of time and a lot of effort to get your horse back on the road to recovery. Thank you guys all for watching today. I hope this has maybe kind of opened your eyes and given you some knowledge on a topic that, again, we haven't really covered before. It's basically, again, these specific horses that colic over and over again. I would say step number one is give us a call and let us talk to you a little bit about what the signs that you're seeing and what we think is the best test. And then we will go from there and help you figure out the best way to diagnose the problem and treat them.